Pulse. Let's see about some important points about pulse. So pulse, it is a number of times the heart beats within the certain time period, usually a minute. So pulse is beats per minute. So pulse is noted as beats per minute. So how will you calculate the pulse? So count the pulse for at least 15 seconds if the rhythm and heart rate appear to be normal, and multiply the reading by 4 to get the pulse rate or heart rate in beats per minute. If the rate is too slow or too fast, then count the pulse for full 1 minute. So this is the method. And what is pulse deficit? So pulse deficit is a difference between heart rate and pulse rate. It's because of non-conduction of weak cardiac beats to peripheral pulse. So pulse deficit is very important. Pulse deficit is difference between heart rate and pulse rate because of non-conduction of weak cardiac beats to peripheral pulse. This is pulse deficit. So the heart rate, if it is less than 60 beats per minute, it is called as bradycardia. Heart rate, it is more than 100 beats per minute, it is called as tachycardia. And causes of changes in heart rate. So bradycardia, what are the physiological causes? Vagotonic individuals and athlete during sleep and induced by carotid sinus and compression, and hypothyroidism and hypothermia. And if it is tachycardia, what are the physiological causes? Anxiety, excessive use of tea, coffee, exercise, smoking, etc. And what are the other reasons for bradycardia? Obstructive jaundice, sick sinus syndrome, hyperkalemia, hypermagnesemia, drugs using beta blockers, calcium channel blockers, and second and third degree AV blocks, and poisoning organophosphorus. And tachycardia, what are the causes? Acute pulmonary embolism, hypertension, drug induced, example adrenaline, thyroid medications, and congenital heart diseases. Next, moving on to palpation of various pulses. Normally we use radial pulse to measure the heart rate or pulse rate, and other sites for pulses are, first one is brachial artery. It is palpated in the antecubital fossa by the compressing it against the humerus. So the examiner should use the index, middle fingers or thumb of opposite hand. With your free hand, flex the elbow to varying degree to get optimal pulsations. So brachial artery. This picture showing the brachial artery pulse examination or pulse palpation. And the second one is carotid artery. It is palpated in the neck by gently compressing it against the transverse process of cervical vertebrae when the patient is resting on the bed or couch. Use the left thumb for right carotid and vice versa. So carotid artery is palpated in the neck. So it is the second pulse. And this picture showing the carotid pulse palpation, carotid artery palpation to measure the pulse rate. And the third one is femoral artery. Femoral pulse, it is palpated in the thigh between the iliac crest and the pubic ramus by compressing the artery against the underlying femur. So it is the femoral pulse. Femoral artery is also used to measure the pulse rate. So this picture showing the femoral pulse. It is the site for femoral artery. And the fourth one is dorsalis pedis. So it is palpated on the dorsum of the foot by compressing it against the tarsal bone. So the left dorsalis pedis is palpated with fingers of right hand and vice versa. If it is right dorsalis pedis, it is palpated with fingers of left hand. So dorsalis pedis, dorsum of the foot, by it against the tarsal bone. So this picture showing the palpation of dorsalis pedis artery pulsation. And the fifth artery is popliteal artery, and it is palpated in the popliteal fossa with the knee flexed at an angle of 120 degree. The fingertips are used to palpate the artery while the thumb rests on the patient's patella. So popliteal artery is also used to measure the pulse rate. This picture showing the popliteal artery pulse rate measurement. So knee is flexed about 120 degree. And the sixth one is posterior tibial artery, and it is palpated behind the medial malleus or the tibia with the foot relaxed between the plantar and dorsiflexion. So posterior tibial artery is also used to measure the pulse rate. So brachial artery, carotid artery, femoral artery, dorsalis pedis, popliteal artery and posterior tibial artery. So this picture showing the posterior tibial pulse.